Hi, this is Dr. Grace Chung from Smile Shop Dental. In this video, we are grafting the anterior maxilla with an allograft bone block in preparation for a future implant for the lateral incisor. We begin with a horizontal incision line on the lingual aspect of the crest of the ridge at the area where the tooth is missing. And here you will see that I am doing a papilla sparing incision on tooth number 8, and I will extend it to the mesial of tooth number 8. And we do it again to the distal of tooth number 6. This type of incision, which again is the papilla sparing incision, allows for the most aesthetic result, and it keeps the gums from healing out of place. So we are keeping the integrity of the gums intact right at that marginal line, because this is within the smile zone. We are then able to lay a full thickness flap, and this exposes the existing bone underneath. It may be difficult to see this in this video, but the bone there has a pretty severe concavity to it where it is extremely thin and not ideal for an implant to be placed at this time. And because we need to have sufficient tissue to cover the graft completely, the flap does need to be fairly large and needs to extend apically to allow enough space for the block of bone. So now we can examine the site and compare it with the size of the bone block and see how the block will be utilized. We design the shape of the block to fit in the void, and we approximate the size that it needs to be. Then we can shape the block to best fit the area. And as you can see here, we are using a handpiece, and sometimes you can use rongeurs or any other instrument to best shape the block conservatively. And as you can see here, I'm fitting the block into position, but it was still not large enough of a space to get enough release of the tissue. So we have to go back into the flap, and we kind of fillet it with the 15 blade. And we do that to the tissue to allow more release of the tissue so that the block can fit completely and be covered in its entirety. So a very important step here is to make sure that you're not necessarily trimming the block so much that you don't have enough for the graft, but we want to ensure that we have enough tissue. Now this is an important step that was not filmed, but it's showed here in pictures, is the decortication of the host bone. And this is when small bleeding points are made into the host bone, and it introduces blood flow into the donor bone once it is secured in place. Without the vascularity, the donor bone will not be able to survive. Now the bone is fitted into place, and the initial pilot hole is drilled through the donor bone and into the host bone. Then a screw is placed to secure the bone block to the host bone. And this step is done a few times and as many times as needed to secure the blocks. If the blocks are mobile after grafting, they will likely fail, so it's important to ensure that they are secured in place. In this case, I was able to split the bone into 2 pieces and only use 2 screws to secure the blocks into place. It was important to identify any areas that were sharp and to smooth them out. And then we finish with the grafting with a particulate allograft bone. And in this case, it's a 50-50 mix of cortical cancellous bone and about 1 cc. Now when the bone is placed, it's important to have a barrier over it to contain it all. This is a collagen membrane, and it prevents the soft tissue of the gums from growing into the bone. The bone growth is much slower than soft tissue growth, so the membrane is needed to protect that growing process. This was a large piece of membrane, but I wanted to ensure it spanned the width of the entire flap and to cover all the particulate bone. And it can be tricky sometimes to place, so I use intermittent sutures to tuck in the membrane and suture and tuck as I go. It's also important to try to get as much primary closure as possible with these sutures to cover the entire area that was treated. Also, it's important to ensure that you not only suture the horizontal releasing lines, but also the vertical releasing lines. We will be following up with this case in about 4 to 6 months. The bone should be fully integrated and we can go back in and remove the screws, and we should be ready for a new implant at that time.